I'm just going to go over here how to uh, document a wound issue. So here's a patient's note. I've documented a wound here on the fourth digit base on the right. And you can see here we did x-rays. He had his ulcer. It's kind of the level. Additional notes, I talk about my collagen kit. So we did doxycycline. Here's my wound documentation. So always remember we do lower extremity wound care for that. But what I want to spend time here is showing you how I did the surgical supplies. So surgical supplies, you put in the wound number or letter A, include billing. It's part of the surgical department. I did that. We did collagen powder. We usually do the 15 packs. So dressing for one wound, 15 Amerx, the lot number, expiration date. There always has to be drainage and moderate drainage. Okay, that's the only way collagen is covered. If it's dry, it's not covered. So we did that. Um, these goals we put in there as well. Secondary dressing is always a bordered gauze right here. So we put that in here, bordered gauze dressing for one wound, 15 of them as well. So it's the gauze. And then the supportive dressing would be other gauzes. And then what we did here is we had to actually put an order in itself. So this is an order I saved. This is something that we made in our previous EMR. So collagen dressing with secondary dressing. So it puts in 15-day kit, the collagen powder, the code, bordered gauze, code, gauze, and then the code and why we're doing it. So you can save these for our quick text, however many of these that you have if you do other ones. So I just want to kind of show how that's done. And then we also talked about nails and stuff like that. So we look at the billing, we have the office visit, we have the debridement of the ulcer, x-rays, the collagen dressings, and then the other gauze that we're billing for. So this is kind of the best way that I know right now how to do this. So you're going to use the ulcer, lower extremity wound care, medical surgical supplies, and then the order for this patient. Okay, once again, hope this was beneficial.